Welcome to another CBCLIPS. In this episode of CBCLIPS, I show you an incidentally discovered right chest mass in a 2-year-old girl. And on the CT scanning, you can see that this is a diaphragmatic hernia containing intestine. You can see on the coronal view that it's in the right medial chest, and on the sagittal view that it's posterior. And this really brings us to the 3 types of congenital diaphragmatic hernias we encounter in children. The Morgagni is anterior. The 2 posterior ones are the Bactelic, which is usually posterolateral, and the Para-Esophageal, the least common, which is posteromedial. So the clinical principle here is that a posteromedial diaphragmatic hernia is a para-esophageal hernia. This is the least common and often the one that is most missed. What is a para-esophageal hernia? Just so we're all talking about the same thing. Well, they're really types 2, 3, and 4 hiatal hernias, as you see here. We put together a series from Montreal of these rare hernias a few years ago, and we found out that there's about a 1/3 association with other congenital anomalies. Reflux is present in about 50%, but there is a wide spectrum of presentation, and they can even be diagnosed in the fetus. And this image shows you a fetal MRI and a postnatal upper GI that can be almost superimposed, depicting a para-esophageal hernia containing the stomach. There are some important clinical principles or technical principles when you operate on these hernias. They often have a very redundant sac that really has to be excised to completely reduce the viscera and to repair the hiatus. The esophagus is almost free-floating within the hiatus, so it really has to be centralized. That means you have to close the hiatus above and below so you don't twist or kink the esophagus. And a fundoplication is typically needed because of reflux. The surgeries can be done open or laparoscopic. I prefer open surgery in very small babies because of the technically challenging dissection, but I do laparoscopic surgery in almost all other patients. And in this slide, you can see the defect after reduction of the viscera, and you can see the laparoscopic video at this link. Thank you, and until another CBCLIPS.